Thank you for giving us the opportunity to spotlight this really important work that is going on in our state. The Office of Healthcare Policy Initiatives is actually in the Bureau of Rural Health and Primary Care, which is in the Division of Public Health. So the Healthcare Directive Registry is a secure online database where you can create, store, and access your Advance Healthcare Directive. The feature within the new registry is that now healthcare providers can log in to search and view their patients' documents. So before we transitioned from the Secretary of State, people could file their documents within the registry, but healthcare providers didn't really have access to those documents. And now also providers can log into the registry, but also the public can be an account holder and manage their own documents. And they can also have their loved ones or healthcare agents have access to their documents they can view their documents through something that's called My Shared Circle. And the biggest change I'm going to say right now with this registry is that we used to have, when it was with the Secretary of State's office, they used to have cards that would print out. When we would enter something into the registry, there would be a card that printed out that had like their file number and then a username and password. And that is like you would have thought that was gold. So that's probably one of the largest changes that we've had, because we don't need that anymore. They just, what they need, what the seniors need, or what any of the public needs, is just an email address that they can log into the registry, and then they can manage their documents. They can upload documents, and they can do that sort of thing. And then again, through this My Shared Circle feature, people can log in to view their loved ones' documents as well. This all started back in 2019. The legislature amended the Idaho Code to allow for the Secretary of State's office to discontinue their management of the registry and have that move over to Idaho Department of Health and Welfare. And part of that was because one of the legislatures had a loved one that had a healthcare directive, and they were not able to access it, and so then this became kind of first and foremost. Now with COVID, this was all supposed to go into effect July 1st of 2020, but with COVID, it was pushed off for a year, and we went live on October 12th, I believe it was, 2021. There were some things that the code was amended for, and that was to, the statute was outlined specific requirements in the new registry, as it had to be a web-based platform. It had to have an option for individuals to register either online or by mail. We would upload that the information. So there were some changes made, and we have had a little bit of a growing pain, but it's been awesome. The Healthcare Advance Directive. This is what it looks like. Okay. This is what it looks like in the registry, because one of the options that the public has is to actually create their form within the registry. There is step-by-step instructions, and it takes one through each slide, and it actually prints the information in there. So this consists of two parts. The Advance Directive consists of two parts. The first part is what's called the Durable Power of Attorney for healthcare, and it allows you to name an individual to speak on your behalf if you're not able to communicate or make decisions about your healthcare. These people are called healthcare agents, and their job is to make sure that your wishes are carried out. Okay. It's also important to identify your healthcare agent, and not necessarily have it be a physician. Okay. most people have like a son or a daughter or some relative that's close to them or a friend. Okay. Um, sorry, I lost my mouse. Um, the second piece of an advance directive is what's called the living will, and this documents your choices regarding life-sustaining medical treatments that you want or don't want during a crisis. Additionally, it can include other directions about your goals and wishes for your medical care. Now, this is not to be confused with just a will. This is a living will. This is all about your health care. It's not about where you're to be buried or um, who is to inherit information or inherit money or whatever. So that is an important thing for the public to understand, is this is all about healthcare. It can include directions about your goals and wishes for your healthcare. The advance directive must only be signed by the patient, and in Idaho, it does not require a notary, attorney, or a healthcare provider's signature. Okay, so that's important to note. To align with the Idaho Code, all questions and decisions are optional and in the healthcare directive form, including identifying a healthcare agent, but it does require a signature. And this image is an example of the first page of an advanced healthcare directive completed online using the features like I had said. So this is what it looks like when it's all printed out. A physician order for scope of treatment is another form that you may have heard or are familiar with. It's also referred to as a post. And the post form is generally used for patients approaching their end of life due to terminal illness or multiple chronic diseases that may impact their life. It works in conjunction with an advance directive, but unlike the advance directive, the post form is an actual medical order, and it must be signed by both the patient and a healthcare provider like a physician, physician assistant, or advanced practice professional nurse. Okay, so this is a screenshot of what we call the patient portal in Vynca Health. Vynca is our vendor for the Idaho Healthcare Directive Registry, and this is where a patient would go to log in. As you can see on the right there is an email address that is required and a password. They have to set up a password. So what happens is if somebody wants to create an account, they would click on create an account over here on the left. And then they would fill out information, and then they can self-register, and it then sends them an email when they're done so that they can finish setting up their account. There's a forgot password feature, and then moving forward, they would then just use their email address that is required and a password. So something important to note here is that they have to have a unique email address. So that means that they can't share an email with somebody else. They can still register to be part of the registry, but they would not be able to upload their documents or make any changes. And we do have quite a few patients that decide, that they share an email address like with their husband or their wife, and that they're okay with that. That they don't have any need to make changes. From here, then they would be able to enter into what they call My Shared Circle and share their information with their healthcare agent. And that is another thing that's important to note, is that once they share documents with somebody, that does not give the person the right to change those documents. It's a view-only access. From here, this is where they would be able to upload their documents, and they can choose a document type. So they can see all documents, they can see just the post, they can see advance directive or additional documents. Okay, so right here we can see the advanced care directive. They have one that has already been uploaded. It says when it was signed. That is because it was created within the registry, and it gives a sign date of 10/12/2001. From here, they can also do the My Shared Circle for their healthcare agents. They can also connect, and this would be where the, the information would be really nice to be able to get out about connecting a smart device. So they can connect a phone or a tablet, and they can do everything within those mediums as well. They also have the access of a help desk. If there's a question, they can, if they're having a problem, they can access that. And it tells the last little thing that looks like a little picture tells them who's logged in. This is our website that talks about advanced healthcare directives and the importance of that planning and why sometimes information is uncomfortable to share. And we really try to dial into the heart of a discussion with people. And then we have a little button that says visit the Healthcare Directive Registry, where people can go and either create an account or upload an advance directive online that will take them actually right there. We will be having kind of to note along with this is that we will be having some videos. We will be doing some webinars. That's the plan, is to do some training webinars, both for clinicians, what we call clinicians, who are the physicians or the physician assistant or a social worker, whoever is working with the person that is creating the advance directive. We will have some videos, and we will also have some videos on how to just use the system as a just as the public. So this would be the page that those would fall on. So we're really excited about our new registry. I mean, this has been a process from beginning to end. Like I say, we came from we came from the Secretary of State's office over to Health and Welfare, and it's been quite a transition. We've learned a lot, and we continue to focus on both new customers and providers. We've provided multiple presentations and continue to work on training materials and new resources. We have had the all advanced care planning resources translated into Spanish, so that's another huge deal. We've reached out to various organizations and associations to request an additional announcement in newsletters and email distribution lists. In addition to the successful transfer of over 51,000 account documents, there were 1,344 new accounts created. So sorry.
One quick question, Jennifer and Mary. I know we usually hold questions, but I think this is really related to this website. I know you mentioned that people need to have an email. Do you have a recommendation for seniors who don't have email addresses as how they do this?
Yeah, so we can add, if they don't have an email, and I mean, people can sign up for an email service. That's very easy to do. If you are a senior, that might not be as easy to do. And we do have patients that ask us to upload documents for them that don't have an email. And that's where I say, if they don't have an email, documents are not prohibited from being in the registry, and they the right people will see them.
Okay, so how do they get them in there? Is there a
they would need to email them to the IHDR email address, which is on this screen, and we get that all the time.
Okay, thank you.
Yeah. And you'll notice, if you are a patient at one of the healthcare facilities around, you'll notice that there's a lot more effort being spent on asking these important questions at admission time, so that you can think about it. And they're not just asking people over age 65 or whatever. They're starting, like in different units, and they're asking about this. So I mean, this is really timely, and I just can't stress enough the importance of having an advance directive. Anything can happen to anybody at any time, and it's important that your wishes are known. So we like the tagline, "Your voice, your choice." So anyway,
Well, Jennifer, thank you so much. And Chris, who's there for support as well. But thank you so much. And kudos to all of you for the work that, again, that you're doing behind the scenes to make this happen. And you're so right. I mean, life is so short and so precious that anything can happen to any one of us at any time. So very important to have, this information and to come up with a trusted individual who can carry out the wishes if you are not able to. And what a better day to do this than April 16th. So again, I thank you so much for sharing your time, your expertise, your knowledge with us.